Okay, good morning. We are live on Facebook. Hi, everyone. Good morning, early risers, early listeners. I'm Andrea Tarr. I'm the program director from SCAN. You are watching SCAN FYI. My guest today is Dr. Ken Sable from Southern. He's the president of Southern Regional Hospital for Hackensack Meridian. That's a long title. I'm not sure if I got it right. So, Dr. Sable, welcome.
Thank you for having me.
My pleasure. So why don't you introduce yourself a little bit better, explain your role at the hospital?
Sure. So I'm Dr. Ken Sable. I'm an emergency physician by training, and I serve as the regional president for the Southern Market of Hackensack Meridian Health. The Southern Market includes Jersey Shore University Medical Center, K. Hovnanian Children's Hospital, Ocean Medical Center, and Southern Ocean Medical Center. And of course, Hackensack Meridian Health is the largest and most comprehensive health network in the state of New Jersey.
Well, that's saying a lot. Well, for the folks in Monmouth and Ocean County, who are probably most of our listeners, who are most familiar with Jersey Shore Medical Center, et cetera.
Sure.
So let's talk a little bit about, the world is a little bit crazy right now. That's an understatement. But Hackensack Meridian Health Hospitals, you opened up to patients again to receive essential care and testing in May, and then limited visitation in June, which is only last month. So my question is, how are the hospitals not only keeping patients safe, but keeping visitors? Suddenly now there's an influx of people that were not coming in before. So how is all that working?
Well, first and foremost, it's been an absolute, crazy ride for the past 3 or 4 months at this point since March. Fortunately, after, a significant, increase in influx and surge of patients in March, April, and May, we started to see a plateau and ultimately a decline across our entire network. I'm happy to say that the numbers are, continuing to trend downward across our hospitals, particularly Monmouth and Ocean counties. We were not hit as hard as Bergen County up in the north, for example, but we still had, a significant number of patients both in our intensive care units, on ventilators, and throughout our hospitals. Currently, we are down to, single digits at Jersey Shore University Medical Center. Your point about, visitation, it's really been touch and go. We've been obviously complying with the executive orders by Governor Murphy. Right. We did open back up to elective procedures on May 26th per executive order, but we did continue to limit visitation, and we opened back up to limitation. We had no visitation for quite some time during the pandemic, but we did open up to a limited visitation policy with certain hours, one visitor at a time, except in extreme situations or pediatrics where we allow both parents to be at the bedside. But it's been absolutely, a challenge, but we're trying to be smart. And ultimately, our first and only priority is to keep our patients and our visitors and the communities that we serve as safe as possible.
So if I want to go and visit someone in the hospital, what do I need to know? What do I need to do as the visitor?
So, first and foremost, we took extensive measures to ensure safety for all of our team members, patients, and visitors. We've created separately designated entrances, separate pathways and areas for COVID patients with symptoms and non-COVID patients. We obviously conduct COVID-19 screening, including temperature checks on monitoring on all of our patients, our guests, team members, and physicians who come into the facilities. We have rigorous and continual cleaning and sanitizing for all of our locations. We do what's called terminal cleaning. We utilize technology, which is called ultraviolet technology. We also use fogging and misting. So we're kind of going above and beyond. We've retained a national consultant to oversee our efforts to ensure that we're complying and doing the best thing we can to ensure our facilities are safe and clean. So, we test our air surfaces, our physical surfaces, our air, water, everything that we're doing to ensure the safety. We're continuing to provide universal masking for all of our patients and team members, and of course, visitors with personal protective equipment. And most recently, we've moved towards requiring that all team members and physicians involved in any patient care also wear eye protection per the CDC's recent PPE guidelines update.
If you had your druthers, would you say to people it's probably still not the greatest thing to visit someone if you didn't have to?
You know, I actually, I would say the opposite. You know, obviously nothing's perfect, and we're trying to do our best to keep everybody safe. But I think that, you know, one thing is clear is that, and as a physician and a healer myself, people definitely benefit from having the emotional support from their loved ones,
right.
and their families, and being able to be with them. And I do believe that it helps them recover, relieve stress, allows them to rest and heal. And ultimately, that can lead to a better recovery from the care and whatever medical conditions they have. So I'm a big advocate of visitation, as long as it's done. You know, if you're having symptoms, don't come to the hospital to visit. You know, we do take temperature.
Well, it makes
checks.
sense, but you have to say it anyway. Yeah.
Right. And we, like I said, we use thermal scanners and other, you know, screening methods to make sure that people are safe. We really try to protect our visitors, our patients, and our team members.
I guess, you know, one of the big things about the whole COVID-19 experience was the loneliness that people would experience being in the hospital and so isolated. So if you can visit someone, you're saying as long as you take the appropriate precautions.
Right. And we provide PPE, personal protective
Okay.
equipment.
Oh, so that's good to know.
Absolutely. Absolutely.
No, you had, Dr. Sable, you had mentioned a website to me before we went live that people can go to check on what's happening in the hospital, what the precautions are. Can you just say that on the air for us?
Absolutely. So if you go to www.hackensackmeridianhealth.org/COVID-19, there are numerous articles, resources, how to get tested, lots of information, our visiting policies. It's a great resource for the public to be able to go, and it's not just for Jersey Shore, it's for all of Hackensack Meridian Health. So we encourage people to seek that out.
And I will put that link in the comments so you don't have to worry if you missed it. But obviously, before you would go to a hospital to visit, or even if you were getting a test, right? If you have to go to the hospital for any kind of an x-ray or any kind of a test, all of these rules would apply to you as well?
Absolutely. And we have guidelines for all of that listed on the website. We have our visiting hours, what kind of things are exceptions, what kind of things would exclude you from coming in. So all of that is posted there as well.
So are people allowed at this point to come into the hospital for elective surgery?
Yes. So we did open up to elective surgery and procedures back on May 26th. We have again, a rigorous process. All patients that are having a procedure need to be tested for the virus. Usually we try to do that 48 to 72 hours ahead of time in order to get the test back prior to the procedure. And then on the morning of, they will again be asked screening questions, as well as have their temperature checked and the usual standard precautions that we take.
I guess now, you know, people have put things off for a long time. So I guess it's time for us to attempt to be more normal. What can people in the community do at this point to just be careful, stop the spread? The fall is coming. We worry about flu season. What can we do as a community?
So the same things that we've been, preaching since this epidemic or pandemic started, which is, be smart, be careful, use common sense, maintain physical distancing, wear a face covering, which is now mandatory in, all parts of the state pretty much by now. Frequently wash your hands. Practicing hand hygiene is, an extremely important tool in our arsenal to fight off this virus. Use hand sanitizer if you don't have access to a sink with soap and warm water. Carry sanitizing wipes with you. Wipe down shopping carts, cell phones, things like that. If you need to sneeze into your arm. Don't sneeze out directly. Those are pretty much the recommendations. I think one thing that is important is don't let your guard down. I think that as we see people getting back to quote unquote normal,
We
and
get complacent.
we get complacent. We let our guard down. I see people walking around with the mask and it's below their nose. Well, if it's below your nose, you're not protected both from somebody else who may be coughing, sneezing, or talking loudly and shedding virus, and you're not protecting those people from you. So, wear the mask, wear it properly, hand hygiene, and practice physical distancing. It's critical to understand, the challenge as we open up outdoor dining and things like that, which is harder because you can't eat with your mask on. Just be aware of your surroundings, hand hygiene, don't touch your face as often if you can. Some of these things are involuntary and we just do them. We don't think about it. But, if you're more actively thinking about it and you're keeping your guard up, perhaps you'll be able to, better ensure your own and others' safety around you.
So really, all the same guidelines that everyone has been sharing from the very beginning, this still applies. None of this has changed.
Agreed. And I think the one additional benefit as we, we're almost in August, but soon we'll be in the fall and we'll be, coming to our typical flu season.
Yes.
And I think that, this is a side benefit of all of this hand hygiene, masking, and social distancing is perhaps that will help us to avoid, a pretty significant, unfortunate flu season. So hopefully a lot of these measures that we're doing now will also benefit us when it comes to the flu and the common cold and all of the typical, respiratory symptoms and viruses that we see on a yearly basis when it comes to the fall and the winter time.
Well, of course, that all makes sense, that all of that would benefit us for, going forward. And, common sense that many of us, I won't say most of us, but many of us are not using it. When I'm out and about and I've seen many people with their mask not covering their nose, I just don't get it. But I guess they don't get it either if they're not doing it correctly. Most of the people that SCAN deals with are, more senior citizens. And so flu season, of course, is always a big concern. And
Right.
Do you feel, obviously, if we were to keep up with these measures, maybe we will have a better flu season, meaning not as serious. But any advice to the senior community out there, how they can better manage this whole thing going forward?
Well, obviously the senior community, as we've seen, is most at risk. Not so much most at risk of developing, of acquiring the virus, more at risk that if you do get the virus, having a more challenging course.
Yes.
Younger people who get the virus tend in general to do better. They have more reserves, lung capacity and other things. Seniors unfortunately don't. So, I grew up in Monmouth County in Marlborough. My parents still live there. They're in their, early to mid 70s. And I tell them the same thing, be extra careful, be extra cautious, take your medications, don't delay your care. One of the things, especially with our seniors who have other comorbid conditions is, the tendency to say, I'm so scared. I can't go out. I can't go to my doctor's appointments. I'm so worried. And then they get some other problem. So you avoid COVID, but
Right.
You deal with your heart disease or your congestive heart failure or your diabetes or whatever you have. So it's really important. And with, certainly today we have really, really good telehealth resources.
Yes.
In fact, at hackensackmeridianhealth.org/COVID-19, you can also get information about that and at our website. But there's lots of opportunities for seniors and others who don't want to travel to still stay in touch with their clinicians and make sure that their chronic diseases are managed appropriately.
Right. I heard an interesting expression from someone recently, situational agoraphobia.
That's great.
And I thought, oh, you know what? I totally get it. So yeah, there are opportunities. You don't have to worry about going to the doctor if you're scared about that, because obviously we have telehealth and even just a phone call. So no excuses, people, to be agoraphobic. That's a crazy thing. So
Right.
Dr. Sable, are you optimistic going forward?
Well, I'm optimistic that if we do, what we know works, and we mask and we exhibit social distancing, physical distancing, and we wash our hands and we maintain, diligence and focus, I'm optimistic we can keep this from coming back to another surge like we had. Do I believe that the virus is gone? Well, clearly it's not.
No.
We were hoping that the virus would be susceptible to the heat. We've seen that that's not the case. We're still,
And we've had plenty of heat, so.
and we have plenty of heat, and the virus has not gone away.
Yeah.
The reality is that as I speak to you today today is July 29th, we don't yet have a vaccine. We don't have therapeutics that are proven cures, and we don't have herd immunity. Herd immunity occurs when a number of people, usually 60 to 70% or more of a population, get the disease
Yes.
and recover, and therefore they have immunity. There's still so much we don't know about this disease that makes it hard for me to feel overly optimistic. I'm cautiously optimistic that we're making great progress. But the reality is, we even don't know that if you had the disease, are you able to get it again? We don't know what level of antibody will confer resistance, and we don't know how long that antibody resistance will last. So these are questions we don't know, and it's scary because we don't want to tell people once you've had it, you're good, you don't have to worry, because we don't know. We don't know if you are safe. We've heard stories of people getting it again. So there's a lot we don't know yet. There's not a lot of data. It's still coming in. So I would just again urge everybody to be cautious. Protect yourself. Wear PPE. Wash your hands. Exhibit appropriate distancing. But definitely don't neglect your health in the meantime.
One last question I want to ask you about. So let's say I get tested on, today is what, Wednesday. I get tested on Wednesday. I find out that I'm fine. I'm negative. So but I still have to be absolutely careful, because what's to say that I couldn't be exposed tomorrow?
And yeah. So what you're getting at there is the incubation period for the virus.
Yes.
5 to 14 days. So you're right. There's nothing foolproof here. And what we try to do when we're planning for elective surgery is to test people as close as possible to the date of their surgery, for obvious reasons. And what we instruct people is from the date of your test, that you are quarantined until your procedure. But again, if you were tested on a Wednesday and you were exposed on the day before, for example, your test may come back negative, and you may not develop symptoms until later. Or you may never develop symptoms and become what's called an asymptomatic carrier, who's actually, has the virus, can spread it, but you don't have any symptoms. So again, there's a lot we're still learning about this virus. And, that's why I can't stress enough the importance of every individual just being diligent with washing hands, wearing your face mask, wear it the proper way over your nose and your mouth, and trying to socially distance as much as possible. Obviously, it's easier now in the summertime because we can be outside. I'm more giving this message for what happens as it starts to get colder in September, October, November, and this thing is still with us. It's going to be a challenge. It's
because I don't think we're going to want to have outdoor dining in the winter.
Right, exactly.
So.
And that's going to be a challenge. Clearly,
we all have to do our part. It's a team effort here, and it's the team of humanity.
This is a population health crisis. This is a population health crisis, and it requires us to be human beings, protect each other, and protect ourselves in the process.
Well, thank you very much for speaking with us this morning. I really appreciate it. Dr. Ken Sable of Hackensack Meridian Hospitals. I will put the link to the website where you can get more information should you want to visit someone in a hospital, should you have to get a test in a hospital, or if you just want to know more about COVID-19. So thank you all for listening today. And remember, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone.